Thank you very much. Mr. Jones, did you want to add anything to that? Or?
No, thank you.
Okay. Thank you again, Dr. Califf. I agree with much of what you said in your testimony. I agree with much of what Senator Cassidy said. But the problem is that the issue we're talking about today is not a new issue, is it? 2010, the National Academy of Medicine recommended that the food and beverage industry be required to put nutritional labels that the American people could easily understand on the front of their packages. According to the CDC, the rate of childhood obesity in America has tripled since the 1970s. And from where I'm standing here, the FDA has not responded in any way with the urgency of the crisis. How long does it take to put a bloody label on a product? And by the way, we'll talk about that in a moment. I don't know if you're going to be telling us, after years and years of research and focus groups, what that label will look like. But the bottom line here is, I would like you to tell me why, when countries around the rest of the world with fewer resources than we do are able to put labels on their product warning parents about the dangers of those products to their kids, how come the most powerful and wealthiest nation in the world is unable to do that? Dr. Califf?
With your permission, I'm leaving soon.
I heard that.
Not for this meeting, but from my job. So I'm going to provide editorial comments, and Mr. Jones can provide you a lot of facts. You asked, how long does it take? Let's talk about tobacco. We were instructed to do that many years ago. We have lost in court on that issue, and we're finally winning now, it looks like. But the point I want to make is, what sounds simple, given the current state of judicial affairs, First Amendment rights, the fact that corporations have the same rights as individuals, every little thing we do, unless specifically in detail instructed by Congress,
Okay.
It's not just that we lose in court, but we lose years when that happens.
Let me, again, I apologize for interrupting, but don't have endless amounts of time. I understand all that. But are you going to tell us with a straight face that you have come before this committee and the American people and say, hey, we have a major, major crisis. We are losing lives. We're spending huge amounts of money. People's limbs are being amputated. We have got to act. And have you pointed a finger at those people who are the cause of the problem? Have you had the courage to take on a very powerful food and beverage industry? You know, there are 15 teaspoons of sugar in this product. How many parents in America know this when they give it to their kids? Say, here, have a Coke, go out and play ball. Have you done your job, and your predecessors, not just you, have you done your job in alerting the American people to the danger and rallying members of Congress to stand up to the special interests who are causing these problems?
With all due respect, I've been working on this problem for all of my career. This is what I've done, and I think I have talked about this very specifically. I think we all wish that we had gotten to the goal sooner that you described. I'm not contesting that. But I do believe in an appropriate discourse with this committee, we need to carefully reflect on the issues in play right now that would allow this to happen. And I'm really heartened to hear the bipartisan support for this, because much of what we try to do, frankly, gets blocked along the way. And we'll talk about that.
Let's be honest here. The food and beverage industry spends hundreds and hundreds of millions of dollars on lobbying and on campaign contributions. You tell me the role that they are playing in destroying the health of America's children.
Well, I'm not going to contest your comment about the amount of money spent on lobbying. I think it's probably accurate. I don't have figures on that. But a lot of the changes that those of us who are interested in better health would like to make are blocked at the level of legislation for reasons that
but I'm
you'd have to
still
tell
not
me.
hearing you. What is the reason that our kids are unhealthy? What role do this industry play? Even now, you're getting out of office. Are you prepared to tell us that this committee, this Congress needs to take on the food and beverage industry whose greed is destroying the health of millions of people?
Well, I'm not going to castigate the people that work in the food and beverage industry.
You're not.
No, what I
That
will
is
say-
your job.
No, it's not to castigate. It's to point out how to make progress in this area. We have an industry that if you tried to change it overnight, there are farmers all over the United States who would not be able to grow the crops they're currently growing. So there needs to be a plan, and it needs to be implemented in a mature, thoughtful way across the country. I'm 100%
The Academy
in
of
favor of the
Medicine in
change.
2010. How many years does it take to do it? 14 years enough time? How many kids have died and gotten sick during those 14 years?
It's not just kids, it's adults, of course. I want to see it change as much as anyone, but we have to do it in a way that considers all the factors that are involved
Protecting
when
the
you make a
interests of the
change.
food and beverage industry. Senator Cassidy?